So today we are going to discuss autoimmunity and what is autoimmune diseases. So our immune system comprises of T cells and B cells. So which is mediated by T cell mediated cell mediated immunity and B cell mediated immunity. So T cell development basically takes place in the thymus and B cell development takes place in the bone marrow, which are the primary site for their development, right? So in relation to this, we are going to further discuss what is autoimmunity, what is basically the other autoimmune diseases which is related to the basically the self antigens which are produced against our own tissue. So there is a term which is called as horror autotoxicus. It is given by Ehrlich, which proposed this term that immune system, and it means that immune system should not be toxic to auto, or that means self tissues. What happens basically is in normal individuals majority of the जो lymphocytes होते हैं reacting with the autoantigens वो पहले ही delete हो जाते हैं in the primary lymphoid organs, that is thymus and bone marrow, जो कि primary site है इसकी development की by clonal deletion. इसको कहते हैं central tolerance. लेकिन few जो self reactive lymphocytes हैं वो escape कर जाते हैं central tolerance को, और they are not deleted in the primary lymphoid organs और ये reach करते हैं secondary lymphoid tissues जिसको कहते हैं spleen और lymph nodes, and there they are down regulated by various mechanisms, one of them being clonal energy, Treg cells जिसको कहते हैं T regulatory cells. There are a lot of mechanisms और इन mechanisms को कहते हैं peripheral tolerance. So thus the normal individuals are tolerant to autoantigens. That means our tissues self antigens, जो हमारे tissues पे जो self antigens हैं उसको हमारे जो antibodies है वो recognize नहीं करते, and there is a development of immunotolerance to autoantigens. So in normal individuals there are no autoimmune diseases which occurs due to the production of autoantibodies against our own auto or self tissues, right? Now what is autoimmunity? In autoimmunity, it is a condition in which the body's own immunologically competent cells or antibodies act against its self-antigen, resulting in structural and functional damage. Whereas autoimmune diseases are the pathological, that is structural or functional changes in the tissues or the organs as a consequence of autoreactive cells. That means as a consequence of antibodies which acts against our own self-antigens. So what are the features of autoimmune diseases? How they exhibit themselves? There is an increase in the elevated levels of immunoglobulins in the body. There are demonstrable autoantibodies against the self-antigens. There is accumulation of lymphocytes and plasma cells at the site of lesion. When people do get benefit from the corticosteroid or other immunosuppressive therapy, and there can be occurrence of greater than one type of autoimmune lesion or a disease in an individual, and the person has a genetic predisposition towards the chronicity, and usually these diseases are non-reversible. So what, as we know that autoimmunity exhibit themselves by which method? It really occurs by, first of all, it results from the failure of a breakdown of mechanisms, that is the immunotolerant mechanisms normally responsible for maintaining the self-tolerance in B cells, T cells or both. Autoimmunity is multifactorial, which can be resolved from a complex interplay between genetic susceptibility, infections, it can be environmental triggers or aberrant immune regulation. These are the factors which results into autoimmunity, are the triggering factors. So it is multifactorial in nature. The three most important etiopathogenic factors which is involved in autoimmune diseases are: first, environmental triggering factors; second, genetic factors; and third, the most important, is the immune response dysregulation. So what is immunological tolerance? Immunological tolerance is when the body learns to determine self from non-self, or the state in which it is incapable of developing an autoimmune response against his own tissue antigens. That is, it is a defense mechanism, and normally the people have this immunological tolerance so that our body can recognize self from non-self. So the mechanism is of two types. Immunological tolerance is of two types. First is the central tolerance, and second is the peripheral tolerance. So what is central tolerance? Deletion of the self-reactive T and B lymphocytes during their maturation in the central lymphoid organs, which I have already told you is thymus for T cells and bone marrow for B cells. In thymus, during T cell development, if any self-antigens are encountered, they are processed and presented by thymic antigen-presenting cells in association with self-major histocompatibility complex. And since they are presented by thymic antigen presenting cells in association with self MHC, it is negatively selected and hence deleted by the method of apoptosis, that means cell death. That means they are negatively selected, the self antigens, as they are presented, and the destruction occurs there only in the central lymphoid organs, resulting peripheral T cell pool is devoid of self-reactive cells. That means जो peripheral T cell pool होगा उसमें हमारे self reactive cells नहीं होंगे, as they are already being destroyed in the central lymphoid organs.